Since 1991, the Health Education Council has been dedicated to providing access, education, advocacy, and training to empower individuals towards a healthy life. Nationally, regionally, and locally, we focus a good deal of our work on the two most preventable causes of death: tobacco use and poor nutrition and lack of physical activity. Each of the Health Education Council's programs starts with the needs of the diverse communities that we serve. We know that communities are not singularly focused around tobacco prevention or obesity prevention or increasing physical activity. We know that communities have multiple needs and issues, and we work hard to try to integrate our community programmatic and prevention efforts. Often, low-income and disparate populations that have high tobacco use rates also have less access to healthy foods, live in environments where there are food security issues, and have few safe places to be physically active in their communities. Our programs take a comprehensive community approach to prevention and to chronic disease management. Our In the Grow program serves preschool children ages 3 and 4 and works in collaboration with Head Start sites. We provide curriculum support and training, education in nutrition, physical activity, and garden-based education. Every preschool site that we work with, we deliver a garden box.
And then this is tomatoes. How many of you like tomatoes?
Me.
Yeah?
I like tomatoes. I like tomatoes.
And then we have some seeds here too. So everybody's gonna get to carry something. This is cantaloupe. Everybody has something to carry?
We teach kids where food comes from, how to grow it, how to harvest it, and in turn we teach kids how to cook, how to enjoy fresh produce. At many of our preschool sites, we also bring farm stands with locally grown fresh produce because we know in the communities that we're working, they have less access to healthy foods. We train parents to run the farm stands and provide cooking demonstrations using those seasonal produce so that families learn how to continue providing healthy foods to their families. Our Children's Power Play program is directed at kids between the ages of 9 and 11, and we teach them in fun ways to integrate and to learn about healthy eating and active living. We work with many partners to provide resources and education in a fun way that can become integrated into their ongoing lessons. Our Nutrition Decathlon program is a fun way to teach kids about the intersect between physical activity and healthy eating. Our Latino campaign efforts address Latino health issues in the Northern California region. We engage key partners in the Latino community to provide education, outreach, coordinate screening activities around diabetes, hypertension, chronic disease management, certainly a lot of nutrition education and physical activity, and really work year-round with a Latino Health Advisory Committee to improve the lives of the Latino community in our region. Our African American campaign is designed to improve the health and lives of African Americans in our region. We work with a variety of partners, including Champion Moms.
My name is Yemanyana Pugh, and I'm a Champion Mom. African Americans are dying each day with chronic diseases such as obesity, type 2 diabetes, and stroke. It's very important for me to do the things that I do in the community, such as community gardens. I have put in over 50 community gardens throughout the Sacramento area. I have gone and done retail to teach families how important it is for them to eat more colorful fruits and vegetables and do more physical activity every day.
Our worksite wellness efforts are directed solely at low-wage workers. So we work with business and industry, primarily in agriculture, manufacturing, with the restaurant industry and other service industries, to integrate health promotion and worksite wellness programs on the job site. Our staff go in and sort of assess the worksite environment, provide training and technical assistance to really improve the workplace for low-wage workers.
For my own personal health, I mean, at first I was pretty heavy, and I would try different kind of things to lose weight, and I would gain it, and I was up and down, and with the new program it got me more motivated.
No podía bajar mi presión y tal vez no hacía lo que tenía que hacer como ejercicio, una comida balanceada o poquito de todo.
No tengo problemas de salud, pero tengo herencia. Mi familia tiene diabetes, alta presión, colesterol. Todas esas cosas me motivaron a buscar algo en lo que yo pudiera pues bajar de peso y mantenerme saludable.
Just looking at me and probably thought inside of them, you're crazy with this heat and walking or cold weather, but my son's actually overweight, and I kind of like motivated him, and I was keeping an eye on his food, and he's been doing great too. He's been losing a lot of weight.
Uno de mis nietos tiene 5 años, con él hago ejercicio en la casa.
I will walk with my son's dog and 4 or 5 miles up and down, and
aprender a contar calorías, aprender a combinar los alimentos, cambiar los hábitos de alimentación.
Our retail program works with grocery stores and other retail food outlets to increase the point of purchase, if you will, for consumers to be able to make healthy food choices at the grocery store. We do a lot of cooking demonstrations at grocery stores and educational programs at the grocery store site to try and encourage folks to make healthy food purchases. Tobacco prevention and control programs have been a cornerstone of the Health Education Council's programs since our beginning. The National African American Tobacco Education Network is dedicated to reducing health disparities among African Americans. We've created a number of culturally relevant resources, such as a national assessment of African Americans' use of quit lines to stop smoking, a clinical curriculum which helps physicians, clinics, and hospitals integrate tobacco cessation into clinical practice, and Be Free Indeed, tobacco prevention tools for the African American church.
In most people's lives, they say, we don't need to be talking about this. This isn't an issue. But when you start talking about health amongst black folks, it becomes a priority. So you got to know that this is a norm that we, as a church, we have to become a catalyst. We're agents of change, so that now we're going to actually change the social norm.
40 Days to Freedom comes as a result of pastors asking us for resources to help their congregation members quit smoking.
How has your faith in God helped you to be able to overcome some of the pitfalls and struggles of trying to stop smoking?
Getting myself in church, reading and learning about what the natural things that God don't want you to do to your body. The spiritual side of it, that's natural when you come to church. You learn the spiritual part, but the natural part that I learned from you and coming to church, that the Bible says don't defile the body. So I know that smoking was defiling my body, and following that, and then when I used to have those urges, what I would do, because later on as it progressed, I started smoking cigars. Okay. And I loved the cigars, but that was just worse because I was smoking a pack of cigars a day. And when you got the big Swisher Sweets cigar, that's a lot. And so now I got it where I just set one in my truck. And whenever I have that urge, I sit there and look at it and read the scripture.
Break Free Alliance is devoted to ending the cycle of tobacco use and poverty. We work to build the capacity of organizations serving low socioeconomic status populations. We create policy papers to further understand tobacco use among underserved communities and offer technical assistance to tobacco control programs and other organizations. We convened an expert panel to develop recommendations on how to reduce tobacco use among homeless persons. We've also worked with states, such as Louisiana, to strengthen their tobacco-free policy for correctional facilities. Our Tobacco Cessation in Correctional Facilities curriculum helps the incarcerated and staff stop smoking.
Dear Health Education Council, I am contacting you for your assistance in my efforts to effectuate a positive, healthy change in the Department of Corrections by implementing a tobacco and smoking ban and helping officers and inmates quit the deadly habit of smoking. Please send me any information, literature, or audio or visual materials that you deem useful. Specifically, I could use an information packet regarding the National Commission on Correctional Health Care. It would be both inspirational and beneficial if you would assist me in this worthwhile endeavor. I would be very grateful for your blessings and professional advice. Sincerely, Michael.
Over the past 20 years, our work has been based on building and maintaining relationships, embarking on collaborations, and strengthening partnerships with organizations. I tell my staff all the time that our work is not about buildings or bricks and mortar or facilities. It's about having trusting partnerships with others who are also dedicated to improving the lives and health of disparate populations, bringing new resources to serve communities through materials, conferences, training, and other tools. What can you do today to positively impact the lives of others? We invite you to partner with us as we continue to work to improve the lives of diverse communities.